Today we're going to be talking about hip range of motion and strength. So we'll start out with hip range of motion first. So you want to make sure you have your bony landmarks all lined up. We'll do all the ones in seated first, so I'll kind of skip around here in some different orders, then we'll do 1 supine and so forth. So when you're measuring hip internal and external rotation, there's some pictures that are going to show you going straight up and in alignment with the feet or with the patella, or you can do it this way. Either way is fine. You can have a vertical arm there, or the arm can stay down when you go out. Okay? Either way, you're going to get the same measurement. I have a preference to doing it this way. Your picture is going to show the opposite. Okay? Go ahead and sit up nice and tall for me. Okay? We want to make sure that he doesn't lean, so if he kicks his leg out to the side, and if he were to lean, that's cheating. Okay? So he wants to sit up nice and tall. Go ahead and bring your leg out to the side, and I would line it up with like the patella, vertical arm right there. That's going to give us around 28 degrees, and I'm looking at the tibia. Okay? So I'm not here, I'm not here, just in alignment with the tibia there. Okay? Now again, when you're reading these numbers are going to be the ones on the inside. Same thing if you start here. Okay? Numbers are on the inside. Okay? So if I go out to the side again, which range of motion measurement is this? Hip internal or hip external rotation?
Internal.
That's correct, because the femur is internally rotating, even though the foot is going outward that way. Okay? Let's go ahead and go this way for me. So his foot's going to go in, but this is what, external or internal?
External.
He's got about 32 degrees there. Okay? So that'd be external rotation. But that would be active, right? Because he did it. Passively, it would be me doing it. So if I wanted to stabilize up here, and I just bring his leg out passively that way. So I lock my hand around that one lever arm, and I go ahead and move, and that'll kind of give me the ability to kind of free float there. Same thing with going the other way for passively. Okay. Let's see here. Let's go ahead and lie supine on your back here. Go ahead and bend both your knees for me. What I'd like you to do is now bring this knee towards your chest without using your hands. So we're going to measure hip flexion. So we're going to go to the greater trochanter. Okay, watch your hand here if you move your hand. Lining up with the midline of the body. And then we're going to line up with the femur, and you can go all the way up to the lateral epicondyle there. And so he's about at 115 degrees, probably blocked by his pants a little bit. Okay, hip flexion. Okay?
What kind of end feel is pants, Yanni?
Soft.
Soft? Okay. Good
Stretchy.
Stretchy.
Depending on the pants and fabric, right? So I usually get this question, how do you find the greater trochanter, okay? It's usually the big bump there, but it's not always easy to find sometimes. If you want to make sure you're on the right landmark, you just externally, internally rotate the hip, and you'll find it'll roll over top of your finger there, okay? So that's one of your questions for palpation skills today. Go ahead and straighten out your other knee for me if you could, please. Next is hip abduction, so moving away from the midline. So we're going to start at 90 degrees, okay? So that means we're going to read the numbers on the outside or inside?
The outside.
Outside, that's correct, okay? So we're going to line things up with his ASISs, so straight across here. And he's going to then kick his leg out toward me, keeping your toes pointed towards the ceiling, okay? Then I'm going to go along down through the femur until I line it up with the patella there, okay? And he's got, looks like about 32 degrees of hip abduction. Now you have to be careful. Go ahead and externally rotate your leg when you go out. You can get further, right? Also, the other point here is, see how his back's coming off the table? I want his back to be flat, okay? Now, if we're gonna do hip adduction, we'll do the right leg as the position that he's in. Scoot towards the edge of the table if you could for me, Dr. Hedrick. I usually like to bring this leg off the edge of the table. And all I'm going to have him do is bring the other leg towards that leg. Okay? We want to make sure again the back is flat. Going straight across from the ASISs. And then again, lining up the femur and the patella. We're around 18 degrees. Hip adduction. Okay? Next one here, I believe we've got almost all of them there. Let's go into hip extension now. So let's lie prone. Okay, same thing. We're going to find the greater trochanter, midline of the body. You can go down to the lateral epicondyle there. Go ahead and extend your hip towards the ceiling, so raise your leg up. And we're gonna measure it there, okay? And he's at about 14 degrees. Pretty tight there, huh?
Yeah.
If I was going to do it passively, it's a little harder, okay? Just because of the long arm arch there. Long arm that you have to go through. So I kind of raise up and I go, it's a little easier to grab if I bend his knee because then his leg can rest on me. And again, the same thing here. Kind of go ahead and raise up and I follow it along. Just takes some little bit of finagling with the goniometer and takes some practice to do passively. Okay, so if we go further down your list, there's 2 flexibility measurements you learned today in lecture, okay? Let's lie on your right side for me, facing away from me. First is the Overs test, okay? So he's gonna bend the bottom knee. Top leg here is the one we're measuring. A positive means his leg cannot go down, and we're testing for tensor fascia latae or IT band tightness. They kind of go hand in hand together. What I have to make sure is he doesn't roll backwards, right? Because then his hip can easily drop down, okay? So I want to kind of stabilize him up here. What I do as a preference is I sit behind him, okay? I grab onto here, I go into hip abduction, and then I let his leg fall down. He has a little bit of tightness there, okay? We're really measuring probably more TFL proximally, like we talked about. Some people like to do it with the knee extended, okay, a little bit more, and you can see he could fall down a little bit more, but I'd probably label him as a positive because his leg's not falling down with the original Overs test with the knee bend, okay? Let's go on your back. And Mason, you're gonna have to ask you to scoot down a little, thank you. Scoot forward for me. Now, when you're measuring the Thomas test, you wanna start out with his leg off a little bit further. If he goes back, go ahead and scoot back for me all the way. Let's scoot back, yeah, keep on going.
Scoot back.
Yeah, there you go. And if his leg's right there and you pick his leg up, you're not gonna get the full effect of the test because his knee's gonna be already straightened because he's not on the edge, okay? Let's go ahead and sit up for me again, Dr. Hedrick, scoot all the way to the edge. What I like to do is he's gonna pick one leg up first. Which leg? Yeah, either one. Okay, cool. He's gonna pick that leg up, go ahead and lie on your back. And what I like to do too is so he doesn't jam his knee, I like to grab back behind the knee. So if you can grab back here.
Okay.
Yeah, there you go, perfect. So if he's gotta lock this hip in, actually has we'll talk about this. For his hip flexors, a negative test because his leg's not coming off the ground. A positive test would be this. That would be hip flexor tightness. This is all passively. If his knee were to extend, like it is a little bit here, what is happening is because the rectus femoris crosses the hip and the knee joint, he's got some rectus femoris or quad tightness, and I'd stretch him in this pattern here. If his leg goes out like this, that'd be sartorius tightness. Okay, does that make sense? So you'll see people stretch in this position and kind of internally rotate there. If his leg goes out this way, it'd be more TFL or IT band tightness, because that would mean that's pulling into hip abduction. So hip flexion. So we have hip flexor tightness there. Knee extension, rectus femoris tightness, sartorius, and TFL. Okay, so you can find out a lot in that position there. Good, so that concludes range of motion. We'll go into strength testing next.
Okay, so let's start with hip flexion. So that would be your iliopsoas. So you have the patient sitting at the end of the table, get them down so their feet are flat.